Good afternoon, everyone. Thank you for joining us. We're just going to wait for one more minute while we have more participants joining us. We thank you in advance for your patience. Welcome to today's webinar on key elements of recovery and recovery-oriented services. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers School of Health Professions, Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy Rivera, and I'm the project coordinator of the center and will be facilitating the webinar today. Next slide, please. One more. Thanks. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. Next slide, please. If you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, please sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen. Following the webinar, you will be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint slide in the next couple of days. Next slide. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you. Please use the chat feature to answer those questions. This presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. This presentation will be recorded and posted on our website. At the time of this presentation, Eleanor McCants-Katz is serving as SAMHSA Assistant Secretary. The opinions expressed herein are the views of the presenters and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS, SAMHSA, for the opinions described in this presentation is intended or should be inferred. Now let's begin our webinar. We have with us Joni Dolce. Joni is an assistant professor in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers School of Health Professions. Joni has several years of experience working in behavioral healthcare settings, namely supported employment. Joni teaches courses in the department's undergraduate program, as well providing training and technical assistance to behavioral healthcare providers. Her research interests include staff training and employment services. She presents nationally on the topic of employment services and is listed as a Society for Human Resource Management recommended speaker on the topic of creating workplaces that support mental health. Welcome, Joni, and I'll turn it over to you.
Thank you, Kati. welcome everyone. I'm so glad to be here. And just to let you know, I have two high schoolers who are working remotely from home in school. So you might hear a little bit of a ruckus, but hopefully not too much. Welcome today. And as Kati mentioned, we are looking at recovery and practices and approaches to create more recovery-oriented services. We have three main objectives for our 1 hour together, really looking at the key elements of recovery and going over some of those guiding principles of recovery, and then also looking at some practices and services that support recovery. And hopefully we'll have time at the end or close to the end to really explore how to apply some of those recovery-oriented principles during this time of social distancing and remote work. So before we get started, if we could just kind of get a sense and just kind of get people thinking about recovery, if you can imagine recovery in one word or a couple of words, use the chat box to identify what does recovery mean to you. And Kati, we can both monitor the chat, but think about what does recovery mean to you in 1 or 2 words. Being okay and here and now, finding a purpose, taking care of yourself, having a healthy lifestyle, hope and empowerment, feeling safe, reclaiming your life. I have lived experience, feeling safe, journey to stability, living without emotional restrictions. These are all wonderful and kind of helps prime us for our discussion today about recovery. And as you all know, riding the waves, I love it. Thank you, Elizabeth. And yes, if you want to, it looks like many of you are just responding to the panelists. It would be great if you could put where it says "to" at the bottom of your chat to everyone, so that everyone can see your chat if that's what you prefer. But yes, all of these are great words to describe recovery, and we'll talk about what recovery is. Oops. Oh, I love this one. Reclaiming purpose, restored, absolutely. September is Recovery Month, and we're at the very last day of September. So just to kind of orient you what Recovery Month is, it's really implemented in our United States, and there are probably some sort of version of it abroad, but it really is about promoting and supporting practices that support recovery. It's really looking at and recognizing and acknowledging that people with mental health conditions and substance use disorders do recover. It's an opportunity for many of the recovery-oriented entities that are around are able to share resources and provide information to really help providers include recovery in their evidence-based services. So today, one of the themes of the Recovery Month for 2020 is celebrating connections. And I think we all, during this time of COVID-19 and some of the crises that are that's happening now, really do that celebrating connections is so important right now to all of us and individuals that we're working with. So let's get started and talking about what recovery is. And William Anthony, who recently passed away this year, was a proponent of recovery very early on, along with Pat Deegan, Dr. Deegan, also an early advocate and continues to be a proponent of recovery. Really looks at recovery as Dr. Anthony describes it, involving the development of new meaning and purpose in one's life as they grow beyond those catastrophic effects of mental illness. And Pat Deegan describes recovery as reestablishing a new and valued sense of integrity and purpose beyond the limits of disability. So both of those definitions have been sort of described and in the literature for the last few decades. and it continues to be a goal of psychiatric rehabilitation services as well as all behavioral health services to really promote recovery-oriented services. But let's talk first about what recovery is. When we think about clinical versus personal recovery, again, this has been discussed in researched and also through anecdotal information from individuals in recovery. And there are two kind of categories, both the clinical recovery, which includes improved symptoms, reduced hospital stays, maybe a reduction in usage of clinical services, maybe people are using medications in a reduced fashion. And then there's also this idea of personal recovery, and that kind of addresses what Dr. Anthony and Dr. Deegan both mentioned. It's this idea of reclaiming one's life after having a diagnosis of a mental health condition. Maybe setting or having new expectations. It's also been sort of identified as learning to live with the illness and achieving and working towards valued social roles in the community. And some of those valued social roles include parent, spouse, partner, worker, student, friend. So parent, if I didn't say that, but those are some of the definitions, but we're going to dig a little bit deeper into each of these. Let's start with, although I do see something in the chat, I want to make sure, just Kathy saying hello. So back in the 50s, Courtney Harding and her colleagues, you may have read about or have seen this in different formats, whether it's in school or other trainings that you've been to, but there was a study done back in the 50s. They started a longitudinal study where they looked at every 10 years, individuals discharged from a state psychiatric hospital and individuals who were really expected to not have a very good prognosis in terms of recovery. And what they found after 30 years, after being discharged from a state psychiatric hospital, that the individuals participating in the study, 83% of those individuals had not been in hospital that year prior. Almost 3/4 of the individuals participating in the research had close friends, almost half were employed. My work is really centered around employment. So, you know, almost 50% employed, people who weren't expected to have a very good prognosis is fantastic, and something that as providers, really important for us to remember and be mindful of. And then 3/4 of individuals reported leading a full to moderate life. There's a little poll, just to get everyone thinking. What percentage do you think of study participants showed slight or no symptoms at follow-up? I think Kadi's going to pull up the poll, or maybe I'm able to do that. Oh, there it is. So yeah, you have a guess of 12%, 27%, 72%, or 94%. What would you guess would be the percentage of people displaying slight or no symptoms at this 30-year mark? Okay, so far it looks like we have either two in the middle, 27 or 72%. Let's wait a couple more seconds. We have about 18 people who are responding, so people are still responding. Okay, so you guys got it, 72%. So nearly 3/4 of the people showed slight or no symptoms. And these studies have been replicated throughout the last several years. There might have been some unique characteristics of these individuals in Vermont. However, over different demographic groups and different areas geographically. The studies still show improvements in both those clinical outcomes, not going back into the hospital the year prior, and slight or no medication or symptoms in terms of psychiatric symptoms. So there are some clinical research studies out there showing that people do clinically recover. But equally as important is really looking at this idea of personal recovery. And back in 2014, Drake and Whitley did some research and collected some personal narratives and personal accounts. You'll see on the right are some different quotes, and they identified in all of the literature around recovery from prior to 2014, and they identified common themes. And some of the notable common themes around recovery were this idea of recovery being a process, not an outcome. So Pat Deegan mentioned, and she's quoted as saying, recovery is a way of life, a series of small beginnings with small steps. Priscilla Ridgway, another recovery advocate and author of articles and workbooks on recovery, also talks about how these small steps are unique to an individual. So this idea of a process of recovery, not having this start and finish, and it's really non-linear in fashion. So people may not, or people may, but more than likely it's this series of more of a small steps and this process, not necessarily a start to finish type of thing. Mary Ellen Copeland, Sherry Mead, also advocates talking about the small steps. And then another key theme identified was the fact that the providers and system promoted choice and independence. And that's kind of what we want to talk about today in a little bit more detail, that people were given choices, people had options and information available, this idea of role models, people who were in recovery, people who had gone back to work, gone back to school, reached levels of recovery that were important to them or reached their recovery goals, would serve as role models and be part of an opportunity for people to see others in recovery. And having that opportunity within the service system is incredibly important. Priscilla Ridgway also notes the importance of peers and having individuals, again, with the lived experience of recovery, providing support to one another. Dr. Ridgway describes recovery as this journey. You look on the right, you'll see what the journey is to. So someone is moving from this idea of despair to hope. You'll see that hope is throughout much of the recovery literature, and much of discussions around recovery focus on the idea of hope and helping people regain a sense of hope and optimism about their future, going from this idea of denial to understanding and acceptance. We won't go through all of these, but this idea of mental patient role is how she termed it back in 2001. Recovering, journeying to just the being someone who's alive with purpose, fellow human beings. So people kind of moving from that role into other valued social roles in the community. This idea of prescribed treatment, moving to a sense of support and partnership. Again, Drake and Whitley and other researchers have looked at both the research and literature and also some of the writings around recovery and identified these 9 common themes. A sense of autonomy, so people making decisions, people who are in recovery or striving towards recovery feel this sense of independence and autonomy, and having housing, having adequate housing, having safe, affordable housing, this idea of employment, which to me is certainly critical to recovery. And Pat Deegan writes about how for her work, and I'm quoting her, work was something that helped organize her recovery. Or maybe I'm misquoting, but I'm paraphrasing. But for her, sometimes having a job or going back to school was what organized her recovery. Having this idea of this social connectedness. Again, the theme this month or this year for the recovery month is maintaining connections, and so critical during this time of social isolation and social distancing. How can we continue to connect with one another? How can we continue to foster connections and help individuals identify different connections? People being part of treatment decisions. So think about ways that you can encourage and really apply this common theme, if you will. How can you make sure people are part of treatment decisions? Having people resume control of their lives is another key theme that has been found to really promote recovery. Overcoming stigma. So I do a lot of work with employers and human resource professionals, and a lot of that stigma you can see from outside. Oftentimes employers may have a misunderstanding or be relying on some of the myths surrounding someone with a mental health condition. So helping individuals to overcome that stigma. And oftentimes that is internalized stigma. People internalize what they've been hearing from the outside, whether it's from the community, such as employers or family, or even professional stigma has this way of really having people internalize that to the point where they often believe that they don't want to or they can't achieve recovery goals. So helping people overcome that stigma. When we talk about the principles and kind of using those principles to help guide our services and supports, we'll talk about how we can help people overcome those. Exercising citizenship, voting, helping people to really exercise that right and those responsibilities. And then again, renewing hope. We'll talk a little bit more about what that is when we talk about the guiding principles. So this old system and what existed for most of the last century and oftentimes may exist in certain areas now is this idea that having a mental health condition was a lifelong disorder, that people never got well, people never recovered. And you saw from the Vermont studies and then there have been some follow-up studies to those that it in fact is not a lifelong disorder and people do recover. People can clinically recover where there might be an absence of symptoms or very few symptoms, and people also recover personally where they might, as you saw, take small steps towards recovery, go through the process of achieving recovery goals. This idea was based on a lot, and many of this, we'll look at this bottom right square, many services focused on stabilization and maintenance. And I think now during the pandemic, it's incredibly important for us to continue to focus on and helping individuals achieve recovery goals. Understandably, people may have gone through, devastating effects of the pandemic, whether physically, their own health, or individuals in their family or staff that they might be working with. They might be grieving, and there might be some very basic needs that need to be met. But we'll talk about how helping to instill hope and continuing to promote recovery goals is really important during this time to continue that process towards recovery. Oftentimes people had a lack of positive role models. Now many people are working as peers, and in that peer role are disclosing their own recovery stories. People who are in the behavioral health system who aren't in designated peer roles, but also have a lived experience, are sharing their stories, and people are seeing that individuals with mental health conditions are recovering, and people are maybe more forthcoming with their stories. The stigma is beginning to get chipped away a bit. So this old system hopefully is transitioning to a new way of believing and thinking and having positive individuals in people's lives to look at in terms of what can be achieved. So when we look at recovery-oriented services, this is kind of paraphrased from SAMHSA's definition of what a recovery-oriented service system looks like. And it's really this idea of services that support self-direction and person-centered services. So the services are really designed to help someone be more autonomous and self-directed. They're very person-centered, so it's not a one-size-fits-all, as you all know in the work that you do, that work should be individualized, and it should not just be what worked for this particular person is going to work for this person. Really building on those strengths and resiliencies of individuals and their families and the communities. So recovery-oriented services really are coordinated with families, individuals, communities, and build on what those strengths and resiliencies of all those individuals and communities are. And it's for the sole goal of helping people improve their health, wellness, and quality of life. However, a recent study in last year, 2019, suggested that recovery services are still inconsistently provided. So why might that be? In their review, Jackson, Blott, and colleagues found that recovery-oriented training programs, and they looked at several studies that incorporated training and recovery-oriented trainings designed to really improve the recovery focus of staff within the behavioral health system. They found that after a certain period, those recovery services and supports after the training were not sustained, or there was a lot of inconsistency in terms of what recovery services were incorporated and what were provided by individuals, by practitioners. Some of those studies saw that the supports were initially provided, but then fell off after a certain amount of time. This suggests that there still continues to be a need for emphasis on recovery-oriented trainings, equipping staff, whether it's in the education system, going through different college programs, with really this understanding and belief that recovery is possible. And it may include supervision and really supervising staff to incorporate some of the elements we're going to talk about to really make sure services are done in a recovery-oriented fashion. So SAMHSA identified these 4 sort of dimensions that support recovery, and we've kind of talked a little bit about home and purpose under the framework of employment, but health is really helping someone to overcome or manage symptoms that they might be experiencing, helping someone identify choices that might support physical and emotional well-being. So helping someone really look at their own wellness, maybe using the dimensions of wellness as a start, and helping someone to really focus on their health and focus on their emotional well-being, particularly now during this time. A lot of people are feeling stressed, and even more than stress. It could be very traumatic for many people, and people who are particularly in areas of our country very highly hit with COVID cases that are really forcing a lot of quarantining and social distancing. So helping someone really establish and make informed choices to really help promote health. Having a stable home is a dimension that supports recovery. So really helping in your work promote health, housing that is safe and affordable, and that's been shown to really support one's recovery, having safe, adequate housing and having a home. This idea of purpose. Someone, a purpose might be working. Having a purpose is going to school. Having a purpose might be helping their family, or being a parent, or having a partner. I mean, all of those areas of purpose need to be explored, and because they so much promote recovery, really encouraging people and providing resources to participate in society. So if you're working with individuals who are interested in returning to work, helping someone with that process, or providing resources or referrals so that someone can access the supports and services needed to achieve that very meaningful activity, have that purpose in life. The other dimension is community. Again, having social relationships, having networks socially that are supportive and loving, and encouraging friendships, and this idea of community and a sense of social connectedness supports recovery, and is something that we as practitioners can begin to address. Certainly now there might be some different ways of engaging socially that we would be needing to discuss with individuals, but having that sense of community, having a purpose, having safe and affordable home life, and having your health are all dimensions that support recovery. So if you can even just take away those 4 areas that support recovery, and as you're thinking about the work that you do and the services that you provide, how are my services supporting recovery? Am I assisting someone in finding that purpose? Am I able to link people with community networks to really improve those relationships and those supports that they have? Is the home safe? Is the person's health, is the person well, and is their health in a place where it should be or can be? So if you think about those areas that we talked about in terms of the old system, and possibly some of what maybe you've encountered over the years, think about what might be some of the barriers to recovery for people. What are some areas that get in the way of recovery? Use the chat box. Stigma, absolutely. So Jennifer is mentioning stigma getting in the way. Are there transportation? Yep. So sometimes it's a very tangible barrier that people experience, transportation, and that transportation could be getting to and from work, self-image. Yep, Sherilyn. Culture, so the idea of culture and maybe services that aren't culturally mindful, insurance and resources, supports, uncontrolled mental health, motivation, stressors, disappointments, absolutely. So all of these might be barriers to employment, barriers to recovery. How do we as providers help someone move beyond those barriers. So just for an example, Patsy wrote motivation, and Brian wrote stressors and disappointments, and Dr. Gonzalez wrote diversity of attitudes. How do we help overcome those barriers, whether it's within our own system or an individual that we're working with? How does, what can we do? So use the chat box and identify what might help overcome the barriers that you've identified. Some additional barriers might be a lack of integration with other services, this idea of the prognosis being bleak and no hope. Okay, so I love it. Rohini wrote vouchers for transportation. Patsy, brief, frequent contacts to establish rapport and trust. Yep, so they may be brief, but frequently getting in contact with people, providing education and offering hope to consumers, making sure the patient is really linked up and has supports in place. Absolutely, support groups, educate consumers to connect to resources and linkages in the community. I love this idea, speak a common language that's understandable to all. So kind of trying to avoid some of the jargon maybe that we use, or some of the language that may not be transferable outside of our own behavioral health services. Peer support, seeing people of color, professionals, absolutely. So there are ways to overcome the barriers, and I think it's important for us in our practice. Oh, we have one more, let me just see. Offering peer support when possible, absolutely. So I think identifying that there are barriers to recovery, thinking about, and maybe even going back to your organizations and thinking about what might be the barriers that our agency has in place, or our services, you know, just inherently are there that might be barriers to people's recovery. And it could be different policies or procedures or practices. So begin having those discussions and thinking about individuals that you're working with, and the recovery goals that people have, and how you may or may not be promoting those, or how your organization or agency may be either preventing or promoting those areas of recovery. Oh, we have one more. Motivational incentives. So yes, there are certainly ways and strategies, and you all came up with lots of great ones just in this 1-minute exercise. So think about how, if you really carved out some time for team meetings or supervision, to really consider how you might be better promoting recovery in your own organizations. So these are some of the guiding principles of recovery, and we'll go through them. I think we have about 20 minutes, so we're gonna go through them, and then we're gonna look at them again under the lens of the current pandemic. So I might kind of address both at the same time. So when we think about this idea of hope, it really is, the idea of hope and optimism and practices that support hope when people may have lost hope are critical to recovery. And if we can think of these 10 guiding principles that SAMHSA has created based on, again, a lot of input from researchers and other theorists in recovery and individuals in recovery themselves, these 10 guiding principles have developed, and we'll look at each of those and maybe some in a little bit more detail for this brief presentation. But hope is so critical, really believing that recovery is possible, sending that message to individuals that recovery is something that people can achieve, and people can overcome a lot of the barriers that you all just mentioned, and some of the barriers that you may not have mentioned, and certainly the stigma is there. And thinking about how you can help someone internalize this hope. Just as we talked about people internalize stigma, how can we help someone internalize this idea of hope and optimism? So think about how, spend a minute writing in the chat, how might you, and think about in light of the current COVID situation, in addition to your work, maybe pre-COVID, or what you anticipate to be your work after the pandemic, but think about how you might be able to use this principle in your work. So how is hope sort of operationalized? How can you instill hope or foster hope or help someone feel more hopeful about their recovery? When we think about principles, we think about those in the sense of what helps guide us in our work and how we might practice the work that we do. So think about this idea of hope. How can we practice hope, or how can we help someone feel hopeful? Oh, we have a chat. Value their trust. Absolutely. So really value their trust and recognize that people are trusting you, and when we're reciprocating and valuing that idea that people are really trusting us to have their best interest. Dr. Gonzalez wrote concrete steps to concepts. How does that person understand hope or culture or respect? Maybe what you need to question is, what do you need is better than talking about the general concept. Celebrate the small victories, see what's valuable to them. What's valuable might be religion, family, career, education. That's what Patsy identified. Rohini, believe in them, pointing out their strengths, yes, and how they can use them to overcome adversity. So Tammy mentioned you might have to overtly point out things that you recognize as strengths. Let them know that they are in charge of recovery, no one else. Absolutely, Jennifer, that the person is in charge, reinforce that. That could be done in a variety of different ways, and that's certainly one way is taking the person's lead. Don't be so quick to offer advice or offer what you think could be helpful, but really recognize that the person has value and the person has their own expertise in the way their recovery goals can be met. Holding hope for minorities and helping them protest and changing the system within, and letting people who are underserved know that we are fighting for more housing, rehabs, and hospitals. Absolutely. So helping people identify ways to advocate. And then Maria wrote value baby steps. And then Patsy, I try to have them look at their challenge, that they are survivors, not a victim or seen as failure. So reframing, helping someone sort of reevaluate or organize their narrative in a way that is more survival focused, not failure or victim. Absolutely. Set goals. Yes, setting goals is very hopeful. Sets that expectation. So this idea of many pathways. People may have a variety of different ways that they feel would be helpful in their recoveries. For some people, that might be medication. For other people, it might be other types of therapy or counseling. For some people, it might be getting a job, reconnecting with family, your support in identifying social connections in the community. So there are a variety of different pathways, but I think the key is, and it goes along with this other guiding principle of person-driven, is to find out from the person. I think someone mentioned it might have been Dr. Gonzalez, but find out from the person who, what their values are, what are their interests, what's important to them, what pathway for them would be the most effective, kind of really building on that autonomy that we saw as a common theme earlier to recovery. Help that person really identify how can they and what is their best method for achieving a recovery goal, and valuing that input. Peer support. again, that was found as a key component to recovery and helping someone really identify supports and peers that they may be able to connect with. You as a provider may be able to facilitate those connections, particularly now during the pandemic. There might be areas of lapse, or there might be gaps, if you will, in terms of supports that a person might have normally been able to access. Maybe they're not available now. So maybe helping that person identify what types of peer supports are available, what types of, the person is a student, are there student run events or other types of supports that could be useful during this time. Strengths, really focusing, I'm kind of jumping around a little bit because we are coming up to about 3/4 of an hour in, but helping someone identify what their strengths are. Someone, I think it was Patsy, identified in the chat, really pointing out what someone's strengths are, identifying that the person has gone through possibly other types of traumas and events that have built resilience, and helping that person recognize and acknowledge that they have these strengths and they have these skills. Oftentimes when people lose hope, and people may have lost hope through their recovery process or through their time in the mental health system, and once you lose that hope, it might be very difficult to identify what strengths you have. So providers, family, friends, other supports might need to be the ones to point out what those strengths are in a very genuine way. And I don't mean to say that you should just be throwing around compliments and doing this in a very insincere way, but really sitting with someone and identifying what those strengths are and reframing that narrative to a more survivor versus victim type of belief system. Culture is important for us to really help someone identify within their culture, and taking into consideration the cultural beliefs and cultural sensitivities or other cultural factors that could influence someone's recovery. So being mindful and being sensitive and educated. So learning about someone's culture, learning about what recovery means within that cultural context. And that might mean, as providers, researching on our own, really digging into what some of the cultures are that you're working with, or individuals from different cultures that you're working in. What are the beliefs around recovery? And really recognizing that different cultures have different beliefs. And again, addressing trauma. And if we think about the current pandemic and the trauma that people are currently going through, this may be just compounding on previous traumas and not addressing that trauma or previous traumas in a way that's sensitive and informed. So making sure that your services are trauma informed and addressing the trauma in order to promote that recovery. And then this idea of respect. So respecting that the person that you're working with has this inherent worth and has value, and that person's value is important, and that person's respecting where that person was, respecting where that person currently is, and helping them move beyond in search of or to help them identify recovery goals. So let's take a little closer look at, excuse me, at these principles and the strategies that support recovery during this time. So we know that the impact of the pandemic has really resulted in this drastic shift in services, often from face-to-face to remote and telehealth. So the guiding principles can still be applied, and I'd like to spend some time as a group, since we have a small group, really looking at how we might be able to apply. I gave some suggestions in some ways when we just talked about the principles, but let's look at hope. What are some ways you can continue to help someone during this time of remote kind of social distancing? What are ways that you have helped someone remain hopeful, or how have your services continued to be person-driven? And we can also let's look closely at this idea of a holistic approach. Holistic as a principle really refers to looking at the person as a whole. So looking at wellness, looking at the person's purpose, like we mentioned, looking at the person's social connections. How can we, okay, Patsy wrote, identifying protective factors to motivate improving behaviors. Absolutely. So helping someone identify what those protective factors might be. Mindfulness-based stress reduction. Absolutely. So when we think about the principle of holistic services or holistic, using this holistic approach, wellness strategies, helping someone identify exercise regimens, as Rohini mentioned. Tammy mentioned mindfulness-based stress relaxation. Absolutely. Elizabeth right now is encouraging people to do things to relax, listen to music, talk to a friend, take a walk. So, we can apply this principle of a holistic approach amid the pandemic. And this might even be something that we need to really emphasize now. Being available to talk, listen to relieve stress, emotional complications, acknowledge the struggles, absolutely, speak about them, online support groups. So all those ways support hope, support this idea of a holistic approach, really helping someone identify ways to incorporate wellness into their current lives so that they are continuing to work towards recovery goals. One of the areas that I wanted to really emphasize is this idea of hope and how we as practitioners might be focusing a lot, understandably, on helping someone address basic needs and services that need to be in place because of some of the urgent issues that are coming out. However, continuing to work on recovery goals, like getting a job, going back to school, other recovery-oriented jobs may have been halted, but continuing to work on those amid this current crisis and what we're going through, and continuing to focus on those might be extremely important to helping someone remain hopeful and optimistic about the future. And again, focus on strengths. If someone has gone through something in the past, they have weathered similar types of storms, really helping that person identify what those strengths are that they've used back then. So for example, if you're working with someone and they are unemployed now because of layoffs or furloughs, helping them look at what strengths they have built throughout their years to help them, again, remain hopeful. These are all sort of intertwined, as you can see. I have a chat. Adding to Javier's comment, masks. Yes, so Javier mentioned one way during COVID that is supportive of someone's continued recovery is care packages for homeless individuals, basic needs, deodorant, toothbrush, hygiene, water bottles, and masks is what Brenda had said. So yes, helping someone address those basic needs is also a way for us to be respectful and recognize that, right now that's where the person is and meeting the person where they are. So at this point, if someone is in need of those basic material resources, helping that person find those. So we have a few minutes that I'd love to hear. Okay, Elizabeth said HCBS staff have also provided some leisure activities and supplies. Absolutely, puzzles, books, crafts, things that people can do at home just to, again, kind of remedy or help someone in that holistic sense of you know, well-being and doing something at home that is productive and you know, helpful in terms of even mindfulness activities. But let's think about one thing you can do in the next month. I said month, but it could be week, that to facilitate recovery at your organization or in your practice. So use the chat box to identify one thing over the next month that you can do, thinking about the principles we talked about, thinking about what people in recovery have said about what's helpful in promoting recovery. We identified those 4 dimensions: home, purpose, community, and health as promoting recovery. So think about one thing you can do in the next month to facilitate recovery. Okay, we have people in the chat. Conversations about services. Absolutely. So having those conversations about how services can be provided once the weather becomes too cold for outdoor meetings. People might be concerned. I think that's a great strategy, really having those discussions now so people know what to expect. Contact other resources in the community to network and see what else is available. Wellness checks via phone, weekly, and even a couple hours a day for a limited number of people. Promote connections, provide support meeting information, provide online yoga relaxation classes. I need that, Rohini. Yes, so there's a lot. Zoom recovery classes, Javier mentions, and also join more meetings like this for more ideas and expertise. Yes, so as providers, take advantage of opportunities, even if it's an hour, to just get yourself kind of thinking along a different way of thinking, or hearing from peers and hearing from your own individuals. But yes, taking care of ourselves, Elizabeth, absolutely. Incorporating self-care exercises in every meeting. That's a great idea, Kyra, really kind of using a portion of the meeting, whether it's a minute or 2 minutes or 3-minute breathing exercises or whatever it might be, but kind of addressing that self-care in every interaction with individuals. Linda, I work in a residential facility. We're still sheltered in place. I assumed many of you still probably are in a social distanced environment. I'd like to develop more group activities that focus on how to cope with the uncertainty, since we don't know yet when they'll be able to access the community again. Absolutely. So brainstorming with your team, brainstorming with others. You know, people mention their own self-care as providers. This could be an opportunity to reach out with peers, maybe not necessarily in your organization, but outside of your organization, to identify strategies that have helped them. Great, these are all wonderful suggestions. Here are the resources, and we kind of did a summary in that last exercise where we sort of looked at all of those resources and ways that you can incorporate some of these recovery principles, some of what the literature has found and what people in recovery have identified as promoting recovery into your own services. Thank you so much. If there are any questions, I think we had some interaction along the way, but if you have questions, thank you, Patsy.
Hi, everyone. So I'm back. Thank you, Joni. So at this time, if you have any questions, we have a couple of minutes left. Joni, if you could move the slide to the evaluation QR code. Thank you. So as previously mentioned, our webinar and all of our training products and services are funded by SAMHSA. And as part of our funding, we require participation in our evaluation surveys. This is how we are funded. So if you could please either use the QR code and complete our brief survey, or I will also send a follow-up email containing the link to our survey. That would be great as well. And also, when you close out of the browser, the web page will automatically send you over to our survey page. So there's many different ways to participate in our survey. Joni, I don't see any questions in the Q&A pod. I think the fact that it was very interactive and everyone was actively participating, speaks volumes about the importance of these topics. We thank you so much for your participation today and for joining us. Joni, do you have any last words?
No, thank you, everyone. Take care.
Yes, absolutely. Thank you.
Thank you for your great participation.
Absolutely. And we hope that you remain safe and well during this time. And if you have any questions, you can reach out to us at the email up in the last slide, northeastcaribbean@mhttcnetwork.org, or our website. And you can follow us on Facebook, Twitter, or LinkedIn. Our handles are Northeast and Caribbean MHTTC. And we also are very active on Twitter. We announce our training webinars on Twitter. So if you could please visit us there and follow us, that'd be great as well. And that is all I have. And thank you for joining us.
Thank you.
Thanks. Take care.